Yeah, I'm Pat Zook. I'm the president and founder of DCAN. We started this in probably 2017 with lots of meetings, and we had 80 people coming and going. This wasn't something that just started spontaneously. And we had lots of input from people actually dealing with this condition. So it's amazing to look around and see what this team has created here today. Is just awesome.
Okay, can we, do you want to do the introductions, or should I just ask you a question, if I may? What do you want to do? Just ask Dr. Zook? Okay. So can you tell us about the medical evaluation process and the comprehensive dementia care that they're going to get at DCAN?
What we do is quite different at the Dementia Resource Center. We, as I said before, we do preventive exams where you don't have dementia. Many of those do turn into dementia evaluations. But we've been doing these for about 3 years or so, and we had to develop the process of how we do it. What we do is different from a regular dementia clinic in that we do some things that they don't do, even at the biggest institutions in the state. So we do a dementia risk assessment, a very detailed, and you'll find a copy over at our booth. There's about 40 or 50 questions, but it actually asks about 200 risk factors. And many dementia risk factors are fixable, so we look at those, and that's one of the first things we want to evaluate. What are the fixable things that we can do? The other thing that's different from other dementia programs is that we do medical stuff. I'm a doctor. I examine you. I examine your body, not just your brain, but your heart, your lungs, your abdomen, and circulation. And not everyone takes complex medical care into account when they're dealing with dementia. I'm a family doctor. I believe in the wholeness of your body, and all parts are important. We also look through the medications. We find an average of 10 or 12 drugs is not unusual in people living with dementia. And we found on average 1 to 3 of those is no longer necessary. And stopping that has made a huge difference in many people. Many of the drugs have known cognitive side effects. And these are people who've been to the largest institutions in our state and are still taking drugs that there are alternatives for. And these drugs are aggravating dementia potentially. The other thing is we have caregiver support right on campus, and it's quite different. So the biggest institutions may refer you to some large organization like the Alzheimer's Association, but people want more grounded recommendations, and they like it that it's part of who we are. We have a dementia-informed counselor who's busy as a one-arm paper hanger, and there's lots of work needing to be done that way, and the largest institutions do not deal with those issues. These are issues, behavioral health issues, that are getting in the way of this 55-year relationship. People have been married 55 years, and now there's a tremor in the force, and it's just because of denial in most cases. The caregiver can't believe this big, strong, wonderful guy won't balance the checkbook anymore because he's just too nasty and ornery. Well, he can't do it. And even college-educated caregivers don't see it for the denial. So a dementia-informed counselor like Becky can sort through that in usually 3, 4, 5 visits and not eternal counseling. If people do need ongoing counseling, she can make a referral. Those are unique parts of what we do. And what we do could take all day for me to tell you everything. Come up and ask me questions if you care to.
I have a question, Dr. Zook. Do you have a particular success story you want to share?
Well, I don't want to give away anyone's particular situation, but a couple of things. Some of the best successes were people who stopped their urinary incontinence drug or found an alternative that doesn't cause cognitive dysfunction, and they became much better. Now, are we calling this a cure? No, we're just improving the symptoms. Improving the symptoms improves the situation at home, which proves to be very important. And we had one person who was fairly young compared to our other patients, who was on 3 seizure drugs, but did not have seizures. And the seizure drugs were used off-label for things like pain and sleep and other things. When she finally, and I said, you can't stop those, you have to talk to your primary to very, very slowly and carefully withdraw from those, she became more like she was before she came to us. So just getting off unneeded drugs or drugs for which there are alternatives that don't have cognitive side effects makes sense to me. It takes quite a while to do that. When I do a chart review, I look through meds and look stuff up all the time. It takes a lot of time and effort. But if you don't get to the basics first, if you don't fix the fixable risk factors, a big one is not using your CPAP. I mean, we see that all the time. Sleep apnea is so common, and using your CPAP 100% of the time is quite rare. But how much brain dysfunction do you want? So I think our main success stories were people looked at the dementia risk factors, we suggested alternatives or fixes, and things improved substantially.
I think you have a book to give away now, is that right? Which is your favorite book here?
Yeah, my book is a 36-hour day, which has a lot of dementia information, but some practical, Tammy, if you could hold it up maybe. Has a lot of practical information. It's an older book, but I'm an older person. So I kind of I like that. But Jennifer and Frank Heinz, Heinze, you are the winner.
Here who was giving them out, but not sure what happened. So Tammy kind of
I know that book.
B56.
That's a great book. I know when we were looking at it, we went, yeah, you'll find a lot of really helpful information in that. So let us move on to Tabby Kolbinger, right?
Thanks, Sin.
Tammy, you want to introduce yourself too?
I will.
Share a success story of caregiver consulting?
Is this on? Okay. First, I realize that we are the only thing standing between you and lunch, so we will get through this. I'm Tammy Kolbinger. I work at DCAN, and I'm a care navigator and educator. I'm going to talk a little bit about caregiver consulting. Caregiver consulting, does anybody know what that is? Just a show of hands if you've had caregiver consulting or if you've heard of it. Okay, a couple people. It's one-on-one support with trained caregiver consultants. So our staff, Christina, and myself are trained caregiver consultants, so we provide this service at DCAN. It's really providing the caregiver with resources to solve problems, skills to care for their loved ones with dementia, and strategies to achieve a balanced lifestyle. We hope that our caregivers have that balanced lifestyle. And you can call DCAN to schedule these. They have become kind of really popular at our clinic as it gives that one-to-one support. Christina's going to talk a little bit about the group setting supports we have, but this is basically, again, a one-to-one setting. The story that I'd like to share through caregiver consulting, I had one caregiver say that I had given her the courage to stand up for themselves with their loved ones at the facility and at friends. And I remind everybody, as well as caregivers, it is okay to stand up for yourself. And it is, especially as a caregiver, even with the person you're caring for, it is okay to take that time for yourself and to stand up for yourself. And if you happen to place somebody in a facility, sometimes you are going to be the only one that is standing up for your person. And it was really kind of cool that she had said that through caregiver consulting, DCAN had given her the courage to do so. And then my book is Dear Caregiver. And this is a newer book. When we were drawing the names for these, Christina said, "What's your book?" I said, "Oh, I can't remember the title." So some of the books we are all very familiar with. This one is, I was looking for a newer one, and what I love about this one, the author clearly states that he did not write these stories, he just collected them. So it is an easy read. You know, it's not War and Peace, so you can get through it as busy caregivers. And I love that it starts each story with a picture. So people had sent in stories. So there is a picture. So for example, a picture would be of me and my dad. I was a caregiver for him. And then there might be a difficult situation like, gall darn it, I couldn't get my dad to brush his teeth. And I tell that story. Now that story might be a mild story. It can be a very raw story as well, as you caregivers know. And then after that, it gives solutions, tips, and tools on how we might solve that problem. And the person whose name we drew for this book is Loretta Anderson.
So we have two Christinas. We have stereo Christinas, but you can tell them apart because one spells it with a K and one spells it with a C. Okay, does that clear it up? Maybe not. All right, so we've got Christina R. is going to talk about caregiver support groups.
Yes, thank you. I'm Christina Rodriguez, as you probably recall from earlier today, and I'm going to talk a little bit about the support groups that we offer through DCAN. We currently offer 6 different support groups throughout central Minnesota, and you will find these support groups in Staples, Long Prairie, Wadena, Becker, St. Cloud, and we are in the process of a Foley, or a Benton County support group. Our support groups meet every month at these locations, and this has been such a cool thing to be part of. I've had the opportunity throughout my career to work with a number of individuals through support group settings. And that has allowed me to see how beautiful the relationships can be between caregivers that come to these support groups. So I want to share just 2 stories, so bear with me for a moment here. My first story is about a gentleman who I met, and he was coming to my support group in Sauk Center. I did forget to mention that. So we also have a support group in Sauk Center. And this gentleman said, he had seen it in the newspaper, and he said, well, I'm just going to come and check it out, but I'm not a caregiver. And I said, well, that's all right. That's cool. You know, come and check it out. And so he came, and as we're chit-chatting a little bit, he said, well, you know, he's got a brother, and he said, you know, my brother's about 10 years older than me, and I'm a little concerned that he might be showing some signs or symptoms of dementia. So my sister and I are helping him with his checkbook. And I said, all right, cool. And then we went on, and he said, you know, yeah, and then my sister, who helps with his checkbook, also just had to have knee replacement, so I'm driving her to St. Cloud twice a week to get physical therapy. And I said, oh, that's cool, you know. And then he went on, and he said, but man, I'm so exhausted because I also have to do the dishes because my wife hurt her back, and she's been laying on the couch all the time. And I said to him, I said, wow, you know what? You kind of sound like a caregiver. And he said, no. I'm just the responsible one, right? So again, earlier we talked a little bit about what is a caregiver, and sometimes caregivers don't even acknowledge that they are in that stage of their life where they're a caregiver because they feel like I'm just doing what's responsible, right? He's like, of course I'm going to help my brother, of course I'm going to help my sister, you know, my wife hurt her back, of course I'm going to do the dishes. But all of those things really are tasks that go along with being a caregiver, right? So after that day, he said, okay, well, maybe I'm a caregiver. And then he'll occasionally reach out to me for caregiver consulting or come to the support groups and kind of share a little bit more of his non-caregiving journey with me. The other thing that I wanted to mention is I have a couple of support groups. We have a support group here in St. Cloud that meets on the 3rd Tuesday of every month. And then I have a support group that meets in Wadena on the 4th Tuesday of every month. And these 2 specific support groups are an absolute hoot to attend. And I will tell you that, not because I think it's a hoot to attend, but because of all the people in our office, I'm the only one who gets to go into the support group. And everybody else has to be outside of the support group doors. And Tammy, and our volunteer Tammy, who's not with us today, she's on vacation. Tammy, and if Dr. Zook's in the office, he'll comment, or Christina will comment, my gosh, you guys have so much fun in there. What are you doing in there, right? And some heads I see nodding, because I see a couple of folks here that have come to those support groups. But I think, isn't that an amazing thing? That we can get a group, and in St. Cloud, we can get 20, 22, even more individuals that come to this support group for an hour and a half, and we just talk about what is this journey with dementia, right? And oftentimes we do laugh, right? Because one of our caregivers, I'm not going to point out if they're here or not today, but she said, oh my gosh, we went to the doctor's appointment, and the doctor's seen my husband and myself at the same time, and you know, we had to disrobe a little bit for what was going on, and she said, and then the doctor said, okay, Bill, you go ahead and get dressed. And this woman said, and I turned around and Bill was wearing my pants. Right? And in any other environment, maybe that's not something you would share. Right? But for our caregivers, then another caregiver said, oh my gosh, my husband was wearing my leggings, right? And she said, can you imagine his chicken legs in these leggings, right? So we talk about sometimes stuff that's funny with our caregiving journey, but sometimes we also share some pretty raw stuff, and we talk about, boy, what is it, this anticipatory grief, right, that we talked about today. And what is that like when we begin to feel like we're losing some of what we had? And it's nice because sometimes folks in our support group will say to the other people, this is what I did. This is how I made it through that. And that is such an amazing thing because caregivers often feel that they are on this journey alone. And being a caregiver for somebody living with dementia has never been intended to be a one-man show. We need support, right? So I encourage you, come to our support groups, any of the ones that we have throughout central Minnesota. You are always invited. I do want to take just a quick note to say, interestingly enough, in my 2 support groups that are in Todd County, they're in Staples and Long Prairie, I get individuals who are living with dementia and their caregivers. And that is a really cool aspect sometimes. Because caregivers will often tell me the reason that their loved one is here at the support group is because they might not have another place for them to go. And that's okay, right? But the cooler thing about it is that oftentimes individuals with dementia will also participate in these support groups. And I had a woman come to the support group with her husband and in Todd County, and I often get couples. So there were 6 people, 3 couples. And the gentleman comes in and he says, well, I tell everybody I have dementia. And his wife said, oh. And I said, well, I mean, I think that's pretty darn cool. You know, we'll call him Roger. I said, Roger, that's awesome. Why do you do that? And he said, well, I was a county commissioner. If I say something dumb, I want them to know why. Right? So he has that awareness. His wife spoke up and said, and I hate it. I hate that he tells everybody that he has dementia. But the cool thing about that is that some of the other caregivers then begin to ask their loved one, well, do you want to talk about it? Right? And last week I was in Wadena and I had a caregiver come up to me who comes to some of these support groups. And I hadn't asked her or invited her to do this, but she had wrote, what is dementia like for her? And she came to one of my speaking engagements and she got up in front of everybody and read, what does dementia mean to her? And Dr. Zook, close your ears for a minute because she said, if you're arguing with your husband, go to church. And if that doesn't work, go to Dairy Queen. So I thought that was very sweet. So on to my book that I have here. So I have Creating Moments of Joy. I mentioned earlier I've been in this field for 25 years. This has been my favorite book for 25 years. I have always felt, although there's great books, a lot of books out there, Creating Moments of Joy, in my opinion, has always been an easy read that gives practical advice. Sometimes we hear advice and you're like, oh, that's cool, but that would never work for me. Right? But this is like, hey, let's just be a quote-unquote common sense caregiver and just do what's ever going to make sense for them. Right? So my book is Creating Moments of Joy, and it goes to Christine from Horizon Health. So thank you, Christine.
Say, I don't want to put anyone on the spot, but these books sound great. Is there any place we can get a list, or should we have been writing them down?
So the majority of these books we did get off of Amazon, but also the majority of these books are available at our office. We have a lending library. So you can come into our office at St. Cloud at any time and check out a number of these books. I should also mention that we also have 2 lending libraries in Wadena, at a couple of churches in Wadena, the city of Wadena. These are intended to be take as you need. So come to our office, Christina, myself, Tammy, somebody will help you just check it out, which is just tell us who you are and what book you're taking. You take it, you read it, you do whatever you want with it, and we just ask that you bring it back when you're finished so that somebody else can use it as well.
I'm glad I asked.
We have a question.
It's not a question, it's just a comment. I work for Great River, and that's
Yes.
part of the system, so some of these books are within Great River Regional Library System, so you can get them.
Right.
In case you didn't hear that, some of the books are at Great River Regional Library, too. Thank you.
Perfect, thank you.
Thank you, Christina, with a C. So now we're going to move on to Christina with a K. DCAN has an extensive service at the Resource Center, and Christina's going to tell us about the Resource Center and how a community health worker fits into the picture.
So, like Sin said, my name's Christina Wojcicki. I'm a community health worker with DCAN. I work with caregivers throughout our various caregiver support services and also throughout our clinical evaluations too. So during each evaluation, kind of like Dr. Zook already mentioned, we provide a list of recommendations at the very end of the appointments. And a lot of those will have different lifestyle change recommendations, which as a caregiver, when we see that, can be a little overwhelming. So my goal as a community health worker is to help caregivers and those living with dementia break down some of those recommendations and turn them into realistic, manageable goals, and take a look at what steps can we take to kind of implement some of these recommendations. So then we'll set those goals at the end of the appointments, and then we track that progress towards those goals and we can make those adaptations to the goals as needed. So I just meet with caregivers as needed for that. Some other resources that we have are like the Dementia Lending Library that Christina mentioned. We also have an online directory, so you can go to our website, which has a lot of different local resources. And then also, DCAN will now be offering cognitive performance testing as part of our services, and that is in partnership with Katrina Sand. A little bit about what that is. So a CPT is a functional cognitive assessment that will allow clients and their care partners and their medical providers to understand with clinical data the client's level of functional impairment and the specific supports that they need to live safely and independently as possible. Many of today's cognitive tests only provide a number, and it can be difficult to understand how that number's score correlates to real everyday life concerns and problems. So the CPT is there to fill that gap, and we're excited to have that service now offered at our office. And if you want to schedule an appointment, you can just give our office a call. As for a success story, I just think we hear very often that the environment at DCAN is just very comforting and welcoming, and caregivers often mention that they just always feel very supported and listened to when they come to our office. And then, let's see, my giveaway book, I chose Atomic Habits. It's not specific to caregiving, but we do talk often, and today we've talked about it a lot, of how can we care for ourselves, and that can be very hard to do sometimes as a caregiver. So this book does a really great job of describing how can we develop new habits. So maybe that's in setting ourselves up for success. So how can we maybe develop a habit to give ourselves that time to care for ourselves? So it's called Atomic Habits, and the winner is Mary Jane Brewster.
Thank you, Christina K. And DCAN has another great service, dementia-informed counseling. So this is Becky.
Hi, I'm Becky Hoffman. I'm a licensed marriage and family therapist and then a clinical trauma professional. So I do private practice, and then about a year and a half, 2 years ago, I... Talk louder? Yeah. Thank you. I started conceptualizing what it would look like to bring a service in to DCAN. And so, with Kay DeFries, we worked on developing the Dementia-Informed Counseling program. And that program, you get 4 sessions, and there's a lot of things that might be used to do. Maybe it's couples therapy, maybe it's individual therapy, some adjustment work. So the idea of the dementia-informed counseling is that we focus on solutions rather than rehashing and talking and venting about problems. And so one of the techniques is to start with different types of questions and helping people start to think about things differently so that they can start to flip that conversation. Primarily, I've been doing couples therapy at the Resource Center. And so often that looks like a person living with dementia and then a caregiver trying to really work through some challenges in their present life with that dynamic having changed so much of their relationship. So some of the questions that kind of help shift that conversation, what has helped the problems in the past? So putting on the emphasis on maybe some of the resources or skills or strengths you've brought to problems in the past, and how might that be helpful in the current problems that you're facing? What did you try that helped recently? What would you want to do again? And then also to think about, well, when are the times the problem isn't happening? So if there's a lot of conflict, or if there's a lot of grief, or if there's a lot of anger, or all of the natural feelings that come with adjustment, kind of looking for the exception, the times that you're not feeling those intense or painful emotions, or having those conflicts. So really just trying to set up and get that conversation and that focus to shift. How many of you have heard of like mindfulness practice? I know it was one of the topics from last year, right? So that can be part of what we also are thinking about is, focusing on solutions, but also focusing on here and now. So therapy tends to look like going through the history, and there can be a lot of things that you're excavating. In the dementia-informed counseling, again, we're not doing that. We're focused on here and now and how to help you feel better, help your relationship feel better, help ease some of the grief, the anticipatory grief that might be happening, help look for resources or opportunities or options to, to feel improvement on what's going on. So what that looks like for me is I'm often doing a lot of motivating, encouraging, supporting, trying to create hope, renewing hope that sometimes gets lost in the mix. Everybody kind of works on developing goals and trying to help people feel like they can fit that in all of the tasks that caregiving brings. Sorry. Just want to make sure I cover everything. And I think sometimes making meaning and having a new understanding of, the different changes, the stages. Maybe, the counseling session looks like information. We're just going through the information of the recommendations that Dr. Zook provided, and just trying to find really easy, day-to-day, small, achievable things that you can try to accomplish. So mindfulness becomes a part of being present with that. Maybe we're practicing that. Maybe people can't even think about how to do that. So then, I kind of talk about, like, what do you do every day? You brush your teeth while you're standing there brushing your teeth. Maybe do some just noticing what's in the room around you. You're present then, if you're noticing the room, right? You're not thinking about 15 things that you have to do later on today or what's for supper tonight. That's future, right? How do we get you right here, right now? Is there like a feedback loop? The other fun challenge with some of that is creating new connections in your brain. And so there are things that Dr. Zook is recommending, and it's trying to figure out how to apply those things. Like, how do I help my sleep? How do I, find time for my social connections? And so just trying to, problem solve maybe some of those barriers to some of the recommendations that the person living with dementia were given through that eval. So that's a little bit of, maybe how I can be helpful and how I'm kind of spending my time over at the Resource Center. So, book, right? My book is called On Pluto. If anybody's ever heard of this book, it also has a documentary. You can look it up on PBS. It's called Have You Heard About Greg? Greg O'Brien is a writer, and he was diagnosed with Alzheimer's. And so he wrote his his book and his story over 20 years of the things that he learned and implemented. I think he's on year 22 of living with dementia. It's a peek into the mind of living with dementia, the fears, the insecurities, how to work through that, what worked for this one individual. He wrote this book to share that. It's a great book. So, hey, Gloria, you get to have it.
Would you mind just passing it over to her?
First off, thanks to the panel. Decan, nice. What? Oh, we have 2 more books to give away. Oh, cool. Oh, this one is called Mom, I Want to Hear Your Story. This sounds like a really good idea. It's a journal that you can write in with your mom. So we have a Dad, I Want to Hear Your Story. And the winner is of Mom, Amy House. Is Amy House? She just happens to be standing up there. All right. And Dad, I Want to Hear Your Story is going to Sandy Flagstead. Sandy, are you here? She's right over there. We do have a few minutes. Lunch is, I just went and looked at the sandwiches. They're out there. I think it's ham, turkey, and veggie. Don't worry, there's plenty for everybody. But before we do that, we do have a few minutes for questions. But since we don't have a mic to run around, I'll use my bat ears to hear it and repeat it then. So the question was, we're talking this morning about dealing with dementia, and the gentleman would like to know what's coming up. What's the future of treatment?
So you meant specifically what's coming for treatment of dementia? Well, I think the latest thing is the monoclonal antibodies, and they end in the suffix UMAB on the end of it. There are many of them being approved, despite panels of 12 people, 11 out of 12 did not recommend they be approved. They were approved. So they are being used in Minnesota. The only places that can afford to give that medication would be Rochester, Mayo, or the University of Minnesota, or large neurology groups in the cities. I think anything you get in medicine, you have to consider the risk versus the benefits. And when I read the Cummings criteria, which are developed to decide who gets the UMAB drugs or not, when I read that to our clients, and I bring it up with everybody, because I think you need to know about it. I don't feel strongly that it's a good thing, but I feel obligated to discuss it, because it is out there, and I know there's people in this room who are receiving that therapy. The Cummings criteria have very specific ideas of who should not get it and who is a candidate. They want to get people early in the course of the illness, and a lot of the people we see have had symptoms for 3 or 4 years. So if you wait to get evaluated for dementia too long, you won't be a candidate for that drug. And in the actual case, I don't go by the 1 through 7. We talk about pre-dementia where you don't have any symptoms. But in that pre-dementia phase, you have no symptoms whatsoever. But for 20, 25, 30 years, the chemistry of dementia is happening in your brain. And the new theory is that we should call that Alzheimer's disease, even though you do not have any symptoms at all. Because we need to call it Alzheimer's disease because it's mayhem. It's bad stuff going on, but you haven't a symptom at all. And we catch people in that phase. I think the UMAB drugs may have more promise. But I don't want to be too negative about these, but I think there will be whole new avenues rather than antibodies. There will be whole new avenues that deal with what's called nitric oxide pathway for blood vessel health. And I think there will be some therapies along that way. Nitrates are what you give somebody for angina. You take a nitrate under your tongue. But nitrates are critically important for blood vessel health. What's good for your blood vessels is good for your brain. What hurts your blood vessels is bad for your brain. And you get nitric oxide, believe it or not, from germs in your mouth, processing the nitrates in your vegetables. That's right, Grandma was right. You need vegetables to get nitrates. The bacteria in your mouth have an enzyme that we lack. Other animals have it, we don't have it. That gets the nitrate into nitrite, which goes to your stomach, and if you're not on Prilosec or other drugs that stop stomach acid, it gets converted to nitric oxide, which is very good for your heart and your blood vessels and your brain. They can't figure out a way to give you nitric oxide without dealing with the fact that it lasts for only a second in your body. Your blood vessels make it all the time up until age 40. Around age 40, it drops off. And then you're dependent on dietary nitrate. And the soils are becoming depleted. There's less nitrate in our green vegetables, but it's mostly greens. So baby spinach, that's my favorite. I can't handle the kale. It always gets stuck to my teeth, but I figure out a way to saute it in coconut oil, add just a little bit of lime juice, and boy, that's really good. But you have to chew it. If you put it in the blender and gulp it down, the bacteria in your mouth don't have time to work on it. You need to chew it. Let those bacteria begin to work. And if you use Listerine and kill all those bacteria, well, guess what? You got no nitric oxide. And if you take away all your stomach acid for more than 8 weeks, you won't make any nitric oxide. Nitric oxide, I think, is going to be the key.
Another question over here. He asked what's on the list for the problems with the
What
traditional
problems do we
medical?
see with the medical community? Well, they didn't teach us any of this stuff in medical school. So I don't blame them for not knowing what we're doing. And they all got burned out during COVID, and they're still burned out, and we're understaffed. They're burned out, we're understaffed, and no one taught them this stuff in medical school. I had to learn all this myself. I was one of those kids reading the encyclopedia when I was 7 years old. So I was in the bottom layer of the bookshelf.
I was using them to press flowers.
Because I was always short. I was always short, and I couldn't read the second layer. So, but I think they just don't know. And a lot of what I know has only been known for 10 years or so, or less. And this thing about using Listerine, killing the germs in your mouth, increases your risk for dementia by 30%, and high blood pressure by 30%. That just came out in the last couple of years. It has to do with nitric oxide.
I think we have time for just one more, but we'll see how it goes. I've got a question here.
How is all this paid for? Does insurance cover this? Or?
Oh, I'm probably ever going to hear that. That might be a question everyone has. How is this paid for?
All right, well, that's a great question. The majority of our funding for events like today is covered through grants. We are a registered nonprofit, so for today we have received one of our larger funders for today is the Minnesota Board on Aging. When we talk about our clinical services, we do accept most insurances, although there is a portion of our intake that insurances will not cover. As Dr. Zook had mentioned, we are still trying to kind of break into a new world of the medical talking about dementia. And many people might agree that when you've gone to the physician or you go to talk to your family practice doctor and you're scheduled for 20 minutes, right? And 20 minutes just is not an ample amount of time to talk about what's going on. Our clinic does it a little bit differently. Your appointment with us is going to be about an hour and a half to 2 hours long. Unfortunately, insurance companies don't necessarily appreciate that because they feel, well, you could go down to XYZ and see a doctor for 20 minutes. But dementia is not a 20-minute appointment. Right? So that does mean that our systems are set up a little differently in a hybrid system. So we do have to ask for private pay for a portion of our services, although individuals can submit that to their own insurance. And honestly, I would encourage you to so you can see the low payout that we would have received. So the intake, which is done with Tammy, Christina, or I, we do have to have that as a private pay. But when you get to the second portion where you see Dr. Zook for the evaluation, we submit that to your medical insurance. Now, we can never know for sure what is or isn't covered because we are a small clinic with 3 staff and a couple of volunteers. So it's difficult for us to know what someone's coverage might be. But when it gets to the medical portion, so seeing Dr. Zook, doing the follow-up appointments, and the CPT that Christina had mentioned, all of those are things that we can submit and we do submit to medical insurances. When we talk about Becky and this amazing service that we have, this dementia-informed counseling, that is also grant funded. We do not submit any of that to the insurances. And people sometimes ask us why, and a reason that we can kind of just quickly talk about is that if Dr. Zook were to be my grandfather and he was living with dementia and I was a caregiver and I came to DCAN and I had my grandpa seen and then I was like, you know what, I'm just really struggling and I need to talk to somebody about it. in the normal insurance world, who pays for that? Do I have to pay? My insurance pays for me to talk about the problems or the issues that I'm having with somebody else who has dementia, right? But my grandpa's insurance isn't going to pay for me to get counseling either. So this is a very unique program that we can only offer to patients who are currently patients or are patients of DCAN because it's only grant funded, and that is funded currently under the Initiative Foundation. We've received a grant for them specifically for the dementia-informed counseling.
Christina, you're being too kind. Am I on? So we don't get paid enough to hire the people that we have without the grants and donations. And I work as a volunteer, and I can't do this forever. I'm 77 years old. I'm going to drop in my harness one of these days. And we have no funds at all to pay for a replacement doctor, since I'm a volunteer. So what we bill, insurance pays about 15% of that. So that we get $15 on $100, 15 cents on a dollar. It's not enough. I have appointments to talk with legislators about pressuring insurance companies to pay what we're worth. Our goal when we started actually about 7 years ago, was to find out what care needs to be done, what do people really need, and then figure out how to get paid for it. But we need to hire statisticians to show the benefits of what we're doing, to get the Blue Crosses and the UCares and all the Medicas and everyone to pay what you need. We put about 6 hours into each evaluation, and at least 3 or 4 hours of my time is basically donated. And most of our grants cover our other employees' salaries, which are very, very moderate. So we are way underfunded. Convince your legislators. And the federal government is now recognized. What we do is called comprehensive dementia care. That's a key word. And they now have an 8-year program to test doing exactly what we do. But we do way more than what the requirements are for that program. And our patients don't have 8 years. So it took them like 1 month to approve lecanemab, the latest UMAB drug, 1 month. It's taking 8 years for the program, the guide program, to decide if what we do, comprehensive dementia care, is worth it. Well, we think it's worth it, and our surveys to our patients we do every year, we get 40 or 50 back every year, and we think it's worth it.
I just asked Tammy if I could ask this. So this was not a question that they have asked me to ask you. Do you take donations?
Wow, Sin, what a beautiful question.
Well,
we are a nonprofit, as we've mentioned before. I'm going to put up a slide here in a moment that has a QR code, so if anybody, we don't ever get up here and ask for funds. That's not what we're here to do. We're here to talk about dementia and help give that education, but the reality is everybody needs funds, right? But before we get to that QR code, I do just want to mention that in everybody's handouts is a survey for today. Please take a moment and fill out that survey. On the registration table, there is a small black tray that you can put that survey result in. And then on our screen here is a QR code that you could scan if you're interested in giving. You could also go to our website, which is dcan-mn.org. And on everybody's table, there are a couple of envelopes. If anybody feels like giving, you are more than welcome to do that.
I just wanted to circle back to how we pay for some of the services. Christine and Dr. Zook touched on them. Our support groups and our caregiver consulting is covered by a grant as well. It is a Title IIIe grant from Central Minnesota Council on Aging. And then part of this conference today is also another grant, and that is the Minnesota Board on Aging as well.
One more thing, there have been clinics started even in St. Cloud like ours about 10 or 12 years ago, and it failed for financial reasons. And there have been maybe 10 or 12 around the state over the past 10 years that all failed for financial reasons, except the one clinic in Montevideo, I believe it is. And they are associated with a hospital that shares the risk.
Just want to mention really quickly that we're having our health screenings also from 1 to 2. If you didn't get the opportunity to take advantage of that this morning, we really encourage you as a way to do some self-care. Get your blood pressure checked, find out what your BMI is, find out what your caregiver risk factor is. You get to take all of that information home with you, and it's just a good way to care for yourself as a caregiver.
And thanks everybody for coming.